Hello everyone. Today, we're exploring the medication known as Qalsody. As always, our discussion is for educational purposes. For any health-related concerns or questions, please consult a medical professional. Description: Qalsody, with its generic name tofersen, is a prescription medicine specifically designed to treat amyotrophic lateral sclerosis, ALS, in adults who possess a particular genetic mutation in the superoxide dismutase 1, SOD1, gene. This medication stands out as the first FDA-approved treatment that targets a genetic cause of ALS to decelerate its progression. The primary mechanism of Qalsody is to reduce the amount of a toxic protein, SOD1 protein, that inflicts damage to motor neurons, leading to the symptoms of ALS. Patients with a mutation in the SOD1 gene produce a toxic misfolded form of the SOD1 protein, which harms the motor neurons, resulting in muscle weakness, loss of function, and eventually death. Qalsody, being an antisense oligonucleotide, ASO, diminishes the toxic SOD1 protein by binding to SOD1 mRNA, potentially aiding in slowing down the progression of ALS. Warnings: Qalsody is not without its risks. Patients should be vigilant about potential side effects and immediately contact their healthcare provider if they experience inflammation of the spinal cord, myelitis, and/or irritation of the nerve roots, radiculitis, swelling of the optic nerve, papilledema, and increased pressure inside the skull, inflammation of the brain linings, aseptic meningitis. Before taking this medicine. Before initiating treatment with Qalsody, it's crucial to inform your healthcare provider about any allergies, current medications, and health conditions. Especially important is to notify if you are pregnant, planning a pregnancy, or breastfeeding. Qalsody's impact during pregnancy and breastfeeding is yet to be fully understood, so it's essential to consult with a healthcare provider. How is Qalsody administered? Qalsody is given intrathecally using a lumbar puncture, meaning it's administered as an injection into the spinal canal. The loading dose is 100 mg intrathecally every 14 days for 3 doses, followed by a maintenance dose of 100 mg intrathecally every 28 days. It's essential to adhere to the recommended dosing schedule and consult your healthcare provider for any adjustments. Side effects: Common side effects of Qalsody include pain, including back pain and pain in arms or legs, fatigue, muscle and joint pain, increased white blood cell count in the cerebrospinal fluid, CSF. Less common but severe side effects encompass myelitis and radiculitis, papilledema, and elevated intracranial pressure, and aseptic meningitis. Interactions: Always inform your doctor about any other medications, supplements, or herbal products you're taking to prevent potential adverse interactions with Qalsody. Dosage: Adhering to the prescribed dosage is crucial for the medication's effectiveness. The recommended dose for most adults is a loading dose of 100 mg intrathecally every 14 days for 3 doses, followed by a maintenance dose of 100 mg intrathecally every 28 days. Always consult with your healthcare provider before making any changes to the dosage. Avoid: While on Qalsody, patients should be aware of potential side effects and take necessary precautions. Regular monitoring and checkups are essential to ensure the drug's efficacy and safety. FAQ: Many might wonder about the age restrictions for Qalsody. As of now, its safety and effectiveness in individuals below 18 years of age are not well established. Always consult with a healthcare provider for specific queries related to this medication. Closing: That concludes our overview of Qalsody. Remember, this information is intended for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.